If your gums bleed when you brush, it's easy to assume that you're just brushing too hard. But that little bit of pink in the sink is usually your body waving a flag, and it's trying to tell you something useful. In the next few minutes, I want to show you what's actually happening in your mouth, the bacteria that live there, how they cause gum disease, and why modern treatment looks the way it does. Stick with me, because once you can see how it works, looking after your gums makes a lot more sense. Let's start with something that surprises a lot of people. Your mouth is home to hundreds of different species of bacteria, billions of individual microbes, and that's completely normal. In fact, a healthy, balanced community of these bugs actually helps to protect your teeth and gums and keeps the more troublesome organisms in check. So the goal of looking after your mouth was never to make it sterile. That's impossible, and it wouldn't be healthy. The goal is balance. When the bugs and your gums are getting along nicely, we call that balance symbiosis. Keep that picture in your head, balance, because gum disease is really a story about that balance breaking down. Now, those bacteria don't just float around loose, they stick to your teeth and to each other, wrapped in a protective gel they make themselves. And that sticky, organised community has a name, biofilm. And that biofilm on your teeth is the stuff you already know as plaque. Here's the important part. Biofilm builds up in a predictable way. Within minutes of cleaning your teeth, a thin film from your saliva coats the surface, and over the next few hours, the first bacteria, mostly harmless ones, stick to that film. Give it a day or two undisturbed and more species pile in and it gets thicker and more crowded. After a few days it matures into a tough, layered community. Deep inside there's very little oxygen, which happens to suit the more aggressive bacteria, and it becomes much more firmly stuck and much harder to remove. This is the single most important idea of the whole video. Once biofilm matures, the bacteria inside are shielded from your immune system, from mouthwash and even from antibiotics. That's why you can't simply rinse gum disease away with a fancy mouthwash. The biofilm has to be physically broken up and removed, and everything about modern treatment comes back to that one fact. So what happens if biofilm is left to sit, especially right at the gum line and just underneath it? Well, the community changes. The friendly, balance-keeping species get crowded out by ones that thrive in those low oxygen depths, and that irritates the gums. That shift from a balanced community to a harmful one is called dysbiosis. And it's not simply more bacteria, it's a change in the type of bacteria and how they behave. A relatively small number of troublemakers can tip the whole community out of balance. Your gums react to that harmful biofilm the way that your body reacts to any irritant, with inflammation. That's the redness, puffiness, and yes, the bleeding when you brush. At this early stage, it's called gingivitis. And here's the good news. Gingivitis is reversible. Remove the biofilm and the gums settle down and recover. But here's the catch, and it's a big one. A lot of damage in gum disease doesn't come from the bacteria directly. It comes from your own body's prolonged inflammatory response. If that harmful biofilm is left in place, the inflammation becomes long-term, and in people who are susceptible, it starts to break down the fibres and the bone that hold your teeth in place. Now we've moved from gingivitis to periodontitis. The gum peels away slightly from the tooth, forming a deeper space we call a pocket. And pockets are sheltered, low in oxygen, and very hard to clean at home. So they let exactly the worst biofilm flourish. That drives more bone loss, which makes deeper pockets, and round it goes. Unlike the gums, the bone that's lost doesn't grow back on its own. Whether that cycle ever gets serious depends upon the biofilm, on your own immune response, and on risk factors like smoking, diabetes, stress, and your genetics. So once you understand all of that, modern gum disease treatment suddenly makes complete sense. Let me give you the logic in 4 quick points. First, it's about managing biofilm, not curing an infection once. Biofilm rebuilds continuously, so treatment is an ongoing partnership, not a one-off deep clean that fixes everything forever. Second, because mature biofilm resists chemicals, the core of the treatment is physically, but gently, removing it from the teeth, the gum line and inside pockets. Third, gentler really is better. Modern instruments are designed to lift away biofilm and harden tartar while protecting the healthy tooth surface and gum. Aggressive scraping isn't necessary. And fourth, it's personalised and prevention-led. Reduce the inflammation, keep the pocket shallow, catch problems early, and match how often we see you to your individual risk. And that brings us to the modern way of doing all of this, called guided biofilm therapy, or GBT for short. Instead of starting by scraping away blindly, it makes the biofilm visible and removes it in a planned, gentle order. Roughly it goes like this. First we assess your teeth, gums and any implants. Then we make the biofilm visible with a harmless dye. It's applied so that the plaque shows up as a colour. Suddenly you and I can both see exactly where it's hiding, and that guides the clean. And it's a brilliant teaching tool because we can then show you the very spots that your routine misses. Next comes the main event, air polishing. A warm spray of water and a very fine powder gently lifts the biofilm and early staining away, reaching the gum line, between the teeth and into the pockets. And it's kind to enamel, gums, fillings and implants. After that, any hardened tartar that's left is removed precisely with a modern ultrasonic scaler. And finally, we check everything is clean, review your gums and agree when you should be next seen, based on your risk, not just a fixed 6 months. People tend to like it because it's more thorough, we miss less when we can actually see the biofilm, and it's more comfortable than traditional scraping. And seeing your own plaque makes it so much easier for you to get cleaning right at home. Which brings me to your half of the job. Whatever we do in the chair only lasts if biofilm is not allowed to mature again between visits. And really that's down to your daily routine. The essentials are simple. Brush twice a day for 2 minutes with a fluoride toothpaste angled into the gum line where the biofilm collects. Clean between your teeth every day with floss or interdental brushes. Your toothbrush simply can't reach those surfaces. And keep your checkups even when everything feels fine. And if you smoke, ask about support to stop. It's one of the biggest risk factors there are. So here's the whole thing in a sentence. Gum disease begins when biofilm is left to mature and tip out of balance, inflaming your gums. And modern treatment, with a bit of teamwork at home, simply keeps that biofilm disturbed and your gums healthy. The reassuring part is how much of this is in your hands. Bleeding gums are nothing to feel embarrassed about. They're an early signal, and the sooner you act on it, the easier it is to turn around. Thanks for watching. That little bit of understanding is honestly half the battle, and your gums will thank you for it.